Hello and welcome to a Drugs and Addiction training series. My name is Melanie Elmore. I'm the co-occurring disorder specialist at Region 4 Mental Health Services. The purpose of the training is to enhance your knowledge related to substances of abuse, review diagnostic criteria from the DSM-5, and to learn about the neurological mechanisms of addiction. As always, if you have any questions or comments about this training or more general questions, please reach out to me via email. These are just a few of the learning objectives for this training. As mental health professionals, it's very important that we stay up to date on current drug trends so that we're able to recognize substance use problems that the individuals that we serve may be experiencing. In addition, we should know common street names to ensure accurate assessment. During this series, we will discuss prevalence of substance use disorders, factors which place individuals at risk for substance use disorders, and we'll also discuss comorbid mental health disorders. We'll discuss signs and symptoms of intoxication and withdrawal for several commonly used substances. There's a great deal of misunderstanding related to withdrawal and when an individual should be referred for detox services. Through this training, you should be better able to identify withdrawal symptoms, discuss these symptoms with your clients, and recognize when you should refer for detox services. Finally, we'll discuss the neurological mechanisms of addiction. Through this training, you should have a better understanding of why addiction is often described as a brain disease. You'll also learn factors which commonly lead to relapse and continued use. In order to provide our clients with the best possible treatment, it's important that we accurately diagnose substance use disorders. In the DSM-5, substance use disorders are classified based on substance categories, which are listed on the slide. Some of the categories contain multiple substances with similar effects. For example, stimulants include several substances, including cocaine, amphetamines, and amphetamine-like drugs. Later in this training, we'll discuss each drug individually, but first I'd like to spend some time reviewing diagnostic criteria for substance use disorders. As you're probably aware, there were a few changes to the substance-related disorders in the transition from the DSM-4 to the DSM-5. Rather than categorizing substance-related disorders as substance abuse and substance dependence, we now use the diagnosis substance use disorder and specify mild, moderate, or severe based on the number of diagnostic criteria that are met. Additionally, the polysubstance abuse or dependence diagnoses were omitted completely. When we have a client come in with who reports substance use, it's important that we do a thorough assessment to make sure that they actually meet criteria for a substance use disorder. Substance use on its own is not enough for the client to meet criteria for the disorder. Rather, they must meet at least 2 of the 11 criteria listed in the DSM-5. Criteria include things such as tolerance, impairment to social or interpersonal relationships, failure to fulfill major role obligations such as obligations at work, school, or home. We'll go through all of the criteria in the next couple of slides, but I want to encourage you to go ahead and familiarize yourself with those criteria just to ensure that we're accurately diagnosing. As I mentioned in the previous slide, alcohol or drug use alone is not enough for an individual to meet criteria for a substance use disorder. As with other disorders in the DSM, they have to meet certain criteria. So according to the DSM, in order for an individual to have a substance use disorder, there should be a problematic pattern of alcohol or other substance use which leads to clinically significant impairment or distress as manifested by at least 2 of the following criteria over 12 months. So we're looking at how that drug use or alcohol use is affecting the individual's life, relationships, and their behaviors. So I'm going to go through quickly what some of those criteria are and talk a little bit about that. After I finish talking, I encourage you to go through and read the next couple of slides. It'll have I have some questions you can ask in assessing. And these questions actually came from this self-help book called Rethinking Drinking. You can see the link to that on the bottom of the slide. You can go there. This is a great workbook to use with your clients. As you can see, it's got great information. These are free. You can order, I think, up to 100 for free. They'll send them to you. You can give them to your clients. I've got a few left in my office. If you're interested, I can send those over to you. So let's talk a little bit about what the criteria for substance use disorders are. So the first criteria is a loss of control. It's an individual who's using more than they intended to. They're drinking for longer periods of time than they intended to. It's not a simple, drinking socially, drinking a couple of drinks. It's more than they intended. The next one is desire or unsuccessful efforts to cut back. So they recognize that there's a problem with how much they're using, and they've tried to cut back and they weren't able to, or they're constantly thinking, oh, I need to quit. The third is spending a great deal of time getting or using or recovering from alcohol or drug use. The fourth is cravings. A strong desire or urge to use alcohol or drugs. When they're not using, they're thinking about when they're going to use next. The next one is use leading to problems fulfilling obligations. So this may be not following through on obligations at work, not completing assignments at school, not taking care of their families, doing things they need to do in their life. The next one's giving up social, occupational, or recreational activities. Maybe they were into sports, or they were into a certain hobby, hunting, fishing, whatever it might be. But they're not doing that anymore because they're spending a lot of time drinking or using. Another reason this happens is because, and I'll talk about this when I discuss how drugs affect the brain, but when you use a drug or you drink, you get a lot of pleasure from that. And so after a certain amount of time, other things just aren't as much fun anymore. You're not getting as much pleasure out of things that used to be a lot of fun for you. So you're always sort of chasing the best feeling you can get, and that ends up being drugs or alcohol. The next one is using in situations that are physically hazardous. And when we think about this, we think about drinking and driving, obviously, or driving while intoxicated. But this isn't the only criteria here. It's not the only behavior here. It could be things like walking home drunk or being in unsafe situations, making risky decisions regarding sex, having unprotected sex, just being in situations that are dangerous. Maybe hanging out in areas that are unsafe, or operating machinery, playing sports, swimming, whatever it may be. But what you're doing intoxicated is putting you at risk for harm. The next one's tolerance. So this is needing more and more alcohol or needing more and more of a drug to get that desired effect, or the amount you're using just isn't making you feel the same way as it did before. And lastly, withdrawal symptoms. There's a long list of withdrawal symptoms for each of the substances. You can look in your DSM. I won't go over those now because we'll talk about those later on in the training. But just the presence of withdrawal symptoms is a criteria. Also, using the drug or a related drug, in the instance of alcohol, and maybe taking Xanax or other benzos to avoid having withdrawal symptoms or being sick. So I encourage you to click through the next couple of slides. It's got easy to ask questions for assessing for substance use disorders. So rather than pulling out the DSM and asking the criteria from there, it's just some easier to understand questions, so we'll get better information from our clients. They'll be able to more accurately answer the questions if they're easier to understand. And these are actually included in this workbook. It's got these questions here. This is where I pulled them from. And there's actually a questionnaire you can actually give your clients in here, and they can take that on their own. And this one's specific to drinking, but the questions can be tailored to whatever substance it is that is the problem. In the transition from the DSM-4 to the DSM-5, there were some significant changes for the substance-related and addictive disorders. First, rather than having separate diagnoses for less severe and more severe substance use, like abuse versus dependence, we now use one diagnosis, substance use disorder, and specify severity based on the number of criteria or symptoms that are met. Another important change is the omission of the polysubstance use diagnosis. This diagnosis was given when an individual was using multiple substances and it was difficult to determine which was primary, but this was omitted from the DSM-5. If a situation arises where it's impossible to determine which substance is being used or the substance doesn't fall into one of the categories, the diagnosis other or unknown substance use disorder can be given if the individual's symptoms meet diagnostic criteria. When recording a substance use disorder diagnosis, you should specify severity and if the individual is in early remission, meaning that they've not met criteria for a substance use disorder for more than 3 months but less than 12 months, or sustained remission, meaning criteria has not been met for more than 12 months. Lastly, you should specify if the individual is in a controlled environment, such as an inpatient treatment facility. As you can see listed on this slide, there are several alcohol or substance-induced disorders that are discussed in the DSM-5. These include psychotic disorder, bipolar disorder, depressive disorder, anxiety disorder, and so on. Pretty much every mental health diagnosis that is listed in the DSM can also be attributed to a substance-induced disorder. The important thing to remember here is that while these symptom profiles for these conditions resemble independent mental disorders, they are temporary and observed only after severe intoxication or withdrawal from alcohol or other substances. It's also possible for substance-induced disorders to occur following initiation or modification of some medications. So it's really important to get an accurate history and know what medications your client's taken, know if there were any changes to that medication that may explain why symptoms are occurring.